I want to ask, if you have any advice for, I don't know, younger adults who might be considering nursing, either men or women. What would be your advice about, if they're considering getting into the nursing profession? What would you say to them? What would your advice be?
One of the things I would say, it truly is a labor of love. I mean, you have to love what you do because it is not worth the money. The money's good, but it's, you're going to work for that money. And you're taking care of people at their worstest time in their lives, when they're sick, ill, demanding, and then the other family members. You really have to love what you do and have a lot of patience.
Yeah.
If you love that and you're compassionate and you feel like you can do it, set the bar high,
And you're having a big impact too, like you said, that they're in a time of stress.
That's right.
When they see you.
Yeah. And your job really is to get them through that process, right? Get them through that whole ordeal as best you can do with the resources you have.
Yeah, just empathize with them. No one wants to be in a hospital, and no one wants to be sick. And a lot of times the patients can take that out on you because they're just upset, and you just can't take it personally. You just got to understand where they're coming from. That's my key thing in all this, is that I understand. I'll do my best to help you so that you don't ever have to come back to the hospital again.
Right. And then, jokingly but not really, it's not like the TV shows.
Right.
It's not.
Yes.
I know it gets a little glorified and stuff, and it's not like watching ER or whatever
Think
show you
yourself.
may want to watch. It's not like that at all by any means.
Yeah, Grey's Anatomy and everything else.
Yeah, very demanding field, but rewarding as well. Like he said, labor of love for sure.
Okay, so if a young adult is considering nursing and looking for a demanding but rewarding profession, nursing fits the bill.
Yes.
Does fit the bill, and
For
as
sure.
mentioned earlier, it's the sky's the limit. And yeah, I mean, if you could get any degree that you're interested in and start out that way. And there's a few folks that I know that got a bachelor's degree in nursing and maybe an MBA,
Yep.
and they are at the top of the food chain now in the hospitals and administration and so forth. So it's there's so much nurse anesthetist, God, you name it, it's just there.
Like nurse, I mean, it just I would say no matter what you do, when you start, just like I said earlier about the whole tree thing, that's just your base, man. Get your degree. If it's something you really want to do, get it, and then kind of find out what you love from there.
Right.
And then really focus on that and go 100%, because you're gonna really, really get a lot
Right,
out
like
of it.
the basic nursing degree that opens up so many pathways, so
doors.
many doors for you
Yeah.
to go in so many different directions. Okay, I think maybe that might be a good plan to wrap it up. Thank you for joining us today for this discussion about the nursing profession.